Neonatal seizure or seizure in newborn babies is what is today's topic, a very dangerous topic, something which is too difficult for me to explain. But I would give you some basic information for a parent, for a new parent who is worried on what was this. Why did it happen? Should I take him to doctor? If so, what are the treatments that would be advised? Will my baby continue to be suffering this? Things like that roughly I am going to include in this video. So do consider watching the video till the end about seizure in newborns. Welcome to Tots and Moms. My name is Kavita. Seizure in simple words is sudden, abnormal, excessive electrical activity in the brain, and these are sudden jerks that would trouble a newborn baby. Neonatal seizure is something which happens within 28 days of a child's birth, and this majorly happens when a baby is preterm or low birth weight. And basic cycling movement, sudden cycling movements or chewing activity that a baby does are simple signs of seizure, but a healthy baby also does it sometimes. So to differentiate it becomes highly difficult, and diagnosis is very important. And these neonatal seizures are mild and short, and if they go unnoticed, it can cause a short-term or long-term brain damage in babies. So it is very important that we are observant. There is somebody monitoring the child for initial days of birth. And one must also remember that this seizure may be a symptom of some underlying condition. It is not a problem altogether, but there is something else that is causing the seizure. So diagnosis and treatment to be done on time is highly important. Otherwise it can cause short-term or long-term brain damage, as I was telling, epilepsy, the baby can be mentally retarded, or because we all know brain is connected to so many parts of our body, so one of the organ can have some problem in future. So it's important to monitor and take care. Let's talk about the causes for the seizure in neonatal cases. At first, it can be due to lack of oxygen during birth, then infection that was undiagnosed, stroke during or post birth, and blood clot in the brain or bleeding in the brain, or even blood sugar or electrolyte imbalance. These can be some common reasons apart from preterm and low birth weight. And in rare cases, this neonatal seizure can also be caused due to benign familial neonatal seizure, which is inherited by father or mother of the child. There are no greater effects, but if not treated immediately, there may be a visible developmental delay. Otherwise, it is not something too serious. Let's talk about signs, symptoms, diagnosis and treatment. In the initial part of the video I was talking, healthy babies also show symptoms or signs like seizure only, because bicycle movement, sudden jerk, chewing like activity in the mouth, healthy babies do that as well. So please keep monitoring. If there is a repetition of certain thing, then that you can check with a doctor. You can shoot a video and talk to the doctor. In detail, if we have to go or one has to explain, it becomes too complex, because there are 4 types of seizure: subtle, clonic, tonic, myoclonic, and each type of a seizure has a different symptom, and in newborn it is highly difficult to make out. Doctors will diagnose using EEG method or testing, or they can also recommend MRI or CT scan, and basis the report the treatment is given. Most of the time it is good to have caught it early, and the treatment is given to children in a way that they are monitored completely, because they are so young and so delicate at this stage. It is highly important and necessary. At home, when you notice something like this is very important. I would like you to make a note of it and talk to your family, whoever has a newborn, or when somebody observes like this, please do not take the child and keep patting or consoling or crying, oh my god, what is happening to my child. Do not yell around the baby. Please leave the baby as is. Cover the surrounding to keep the baby safe with soft pillows or something. After that, after when the baby is coming back to normal, then calm down, sit next to baby, talk to the baby. When the baby is fine, take in hand, and then please visit the doctor or the hospital immediately. These are certain things that we fret, and there are chances that even when we know things, we make mistake. But when we are aware of what needs to be done, it protects our child in a better way. So I really hope that you make good use of the information given here. And I on this channel make a lot of videos which can be helpful to new parents. So one such video is on finger sucking. Most of parents want that habit to be gone, but it can not be good to always pull it out from your baby's mouth. The reason you will know in the video, so do check that. And I have also spoken about postpartum hair fall. Why does it happen? How can a mother safeguard? Because you always I mean, at that point of time we feel as if we are going bald, and certain information can be really helpful, which is that video going to do. So do check that. Details will be in the description. And I run an organic food store by name Tots and Moms Foods, a chemical-free USDA certified food store which is there past 7 years. Our products are on Amazon, Flipkart and FirstCry, from foods for babies, that is porridges, cereal mixes, instant mixes, to cookies, pancake mixes. Everything is sugar-free. We use jaggery to make cookies, millet-based products. So most of them have showered love on our products, and worldwide our products are being sold. Do check them. I'm sure you would love them, and see the review to be sure before you buy. And our customer support team will be happy to help you to choose what is good for your child. So thanks again. I'll see you soon in yet another video. Till then, take care of yourself. Bye.